Hello and welcome to this session of Finishing School. I am Dr.Subhramita here. Let's start. Very soon you all will be graduated and will be passing out from this college, isn't it? Right after that, there will be a new phase of life that you all will enter into. 4-5 decades before, the social structure was little different. Hence was the thought process of the parents. They used to think the girl child has completed graduation, now find out a good alliance and let her get married and allow her to settle down with her family life. But now the situations have changed, the social structure has changed, hence the thought process of the people too have changed. Now after graduation, a girl child is being given a duration of 3 to 4 years time for working to achieve the goal of her life, to prove her identity in the society, to taste the success of life. So post completion of this graduation, you will be on your path towards achieving the success. So the journey towards the success will start after that. Now, if you look at the successful people around us who have happened in the past or are happening in the present, you will find that there is a common path that they all have traveled through. How is it? It is the success what we are seeing in their life. It is only the tip of the iceberg. Underneath that, there is a huge iceberg made up of lots of struggle, rejection, n number of sleepless nights with the dream of achieving success in life. After they all have accumulated that huge iceberg, only then successfully they could construct the tip called success. So if you have the dream of reaching to the goal of your life, then you also should remain prepared to pass through this way. Now when you are doing this journey in this path, you need to equip yourself with two things. What is it? Number one is you should be prepared physically, that is the physical preparedness. Number two is the emotional preparedness. Physical preparedness, what is it? If you are prepared physically, then the physical ailments which in this age group you are liable to be affected by, those can be avoided, those can be prevented. That is called physical preparedness. Emotional preparedness, what is it? As I told you, in the journey towards success, n number of rejections, failures, falls will be there. So how to cope up with that? You should equip yourself with the stress management technique. So emotionally you should remain prepared. Under that we will today discuss. As a student, when you are going to appear the competitive exams or now the final year graduation exam, if there is a vast course of study, how to finish it within the available small span of time. I will share with you a trick to do that. Then after, how to manage the stress effectively in any circumstance of life, that also we will discuss. And then finally, I will share with you another one, a wonderful technique where the negative situations of life can be changed into positive. So let us start with the physical ailment, and under that the first common ailment that we will discuss is acne. So acne, usually we hear acne and pimples, the two terms, isn't it? What is the difference? The difference is only that if it is a single, then it is called pimple. If it is in a group or multiple, it is called acne. So, there is no other difference, it is single and here it is multiple, acne or pimple. So, more or less same. Now, what are the causes of acne and types of acne and how to deal with it, that we will discuss. So, first of all, see the causes of acne. How and why acne develops? Acne develops, as you can see, is the structure is the hair follicle is there in the bottom and hair is growth is happening there. So, underneath the skin we have a hair follicle. That means under the skin we have small tiny glands called hair follicles or sebaceous glands. In medical term it is called sebaceous glands. What is the function of those glands? They will secrete a oily substance, liquid substance, which will come up to the skin through the pore, through the hole of the skin. It will come to the above the skin and it will make the skin moistened. As you can see, the gland will secrete the fluid and through the pore it will come to the surface of the skin and skin will become moistened. If in any circumstance, if you find the sebaceous gland is stimulated more, then it will secrete more oil and the oil name is sebum. So, it will secrete more sebum and that sebum will come up and it will clog, obstruct the opening of the skin pore. And when the skin pore is obstructed, further whatever secretion will happen, where it will go? It will again remain accumulated there. Then that will bring the infection, that will bring the bacteria inside it. So, that gland will now become swollen, inflamed, painful, reddish and you find the bump like structures on the face. It is not only in the face, anywhere in the body you get, but acne pimples are more appear on the predominantly on the face. So, those structures are called acne or cystic acne. How it looks? I will show you a picture. See, this is a face where you can see the earlier pimples marks were there and top multiple acne we can see and how those are glandular looking like abscess, boil like that. So, these are the sebaceous gland inflammations, these are called acne. When it will happen? This is also another case, there the acne has happened. It can happen not only in the puberty, at any time when there is a change of hormone. Number one cause of acne is hormonal imbalance. So, when the hormonal imbalance takes place, in case of a woman at the time of puberty, at the time of pregnancy, post delivery and menopause. Menopause means 40-50 years age. Do you say at that time a woman also can develop? Yes, of course. As I showed you in the previous slide, that is the case of menopausal ailment. This is a woman at the menopause age, 49 years age, and you see how the face is full of acne. So, in menopause age also we may get this acne. This is a boy at the puberty age, of around 17-18 years, how he has also developed. Here also we can see bumpy structure, whitish pus depositions, all that. So, this is again because of hormonal imbalance. So, if we look at the cause, number one cause is hormonal. So, I have shown you two pictures how the acne because of hormonal cause, if it appears, what is the appearance or how it looks. By looking at the acne itself you can make out it is from the hormonal cause or not. Next is dandruff. Dandruff can cause acne. How can it be possible? Yes, dandruff can cause acne. In case of dandruff, what happens? We get dryness of the scalp. So, what will happen? If scalp becomes dry, then those powder like things or flake like things that will come up. Now, those things it will fall on your face, it may fall on the shoulders, it may fall on the nape of the neck. So, if someone is having acne because of dandruff, These are the areas where we will find the eruptions or acne or pimples. Those are not looking like the acne of the hormonal cause. Hormonal cause means you get the cystic acne, but in case of dandruff it will be small like prickly heat. I will show you some pictures. See, this is a picture of dandruff causing acne on the forehead. On the forehead it is full of. The previous picture we saw it was on the cheeks, but here it is on the forehead. One more picture. Back. It is a girl of puberty age. The back is full of pimples. You see how small and whitish pus like stuff is inside that. So, now it is very clear that how two different types of acne happens because of hormonal cause, because of dandruff cause. Then number 3 causes. Medication. Sometimes for some people the medication, if it is too long medication or too strong antibiotic, then the body is not able to cope up with that and body reacts with the production of overheat, with the production of acne, all that. Particularly in case where the pneumonia happened, now the COVID, because of the COVID lot of steroids, antibiotics were given to the people. If it is a case of tuberculosis where the 3 drug combination or 4 drug combination, lot of antibiotics every day for the year of 6 months, 1 year is being given, that can cause the side effect. And here is a case I will show you. It is a lady, you can see on the chin and near a nose, nostrils we find it. This lady has taken HRT. HRT means hormonal treatment. She was having ovarian cyst, some problem, and doctor has given hormonal therapy, hormonal pills to be taken. She has taken for around 20-21 days medication, and after that she has developed such type of acne. So, number 3 cause is medication. Then number 4 cause, next, stress. Can stress cause acne? Yes, of course. Why? Because when we are under stress, the stress hormone gets released by our brain. We have the slide. I will show you what are the hormones. Those are secreted. When we are under stress, the stress hormones called cortisol or CRH, corticotropin releasing hormone. These type of 2 stress hormones, if they are released, they will do what? They will go and they will stimulate the skin cells and which will secrete more sebum. Here as I have shown you, skin cells and sebum, they will stimulate, and as a result we will get the acne. If CRH is secreted because of the stress, that also will go and do the inflammation of the sebaceous gland, there also you will get acne. So, if it is because of stress, then more oil production will happen in the face. You may find the face is oily, you may find along with that there is a dryness of the scalp, and thus pimples may appear. So, this is another cause called stress. Coming to the next cause, cosmetics, that many of you already would be having experience of that. Cosmetics, all cosmetics are not skin friendly. Every individual skin texture is different. So, you cannot say that the marketed product such and such, one cap will fit for all heads. Your skin is different than that of mine. What suits me may not suit you. So, the cosmetics, whatever is available in general, you cannot keep using that always. It may have some disadvantage over your skin. So, many times after going to the parlor, the women start developing acne, pimples, because those cosmetics will be having some harmful chemicals, and that may bring the acne or pimples. Next, the dietary error. It is very important as a student. When you are going to appear the exams, you are going to do hard work in your studies. You have to be careful about your food also, because if there is a dietary error, that may bring acne or pimples. So, what to eat and what not to eat, that we will discuss. Sugar. If you are going on eating more sweets, more sugar, then you are liable to get affected by acne, pimples. How it happens? If you take more sugar, in order to digest that sugar, body will secrete more insulin. If sugar is more taken, insulin more will be secreted from inside the body to absorb that sugar. Now, when more insulin is secreted, there is a hormone called IGF-1 that will be also secreted. Now, this insulin and IGF-1, these two they will go and they will secrete more male hormone called androgen. This male hormone androgen, what it will do? Again it will go and stimulate the sebaceous glands. So, if you have more androgen, then more sebaceous gland will be stimulated, more sebum will be secreted. So, more oil production and again that inflammation of sebaceous gland, hence you will have again acne. So, you should take care when you are eating sugar. The refined white sugar, it is very, very dangerous. I will discuss in detail what kind of food we should have and we should not have. Number 1, limit the added sugar. As I told you, the additional sugars whatever we are adding, that it has to be limited, because how sugar causes the harm, that already we discussed. Number 2, the sugar bombs. Sugar bombs means the energy drinks. The beautiful advertisements come and we get fascinated to see that, oh, the moment you drink you feel energized. You must know the logic behind. It contains lot of sugar inside that. That is why you feel energetic. So, that should be avoided. Then number 3, the refined carbohydrate. Refined carbohydrate means what? White bread, white pasta, white rice, all these are the refined carbohydrates. They do not have fibers in the required amount. If fiber is not there, then it is not going to help you in the digestion. That is why you should avoid this. So, these are the things you should avoid not to eat. Now, what are the things you should eat, that we will discuss. Number 1, the food which is naturally having fiber in rich amount, that is the fruits, all vegetables, everything. Foods that are rich in antioxidants, which are rich in the all fruits, spices and tea and vegetable, all that also you can have. Tea also, sugar should be limited. Then number 3, food which are rich in omega 3. Omega 3 means what? It is a content that is required for the beautiful texture of the skin, and where it is available? Available in the flax seed. Small like till seeds, it will be available in all nuts and spices shops, we get it, that is called flax seed. So, flax seeds, walnuts, fatty fish like salmon fish, all those things will contain plenty of omega 3. Next, the zinc. If you have good amount of zinc in your body, the inflammatory process will be reduced. Usually whenever the child falls sick or you have any physical ailments, you do not have the taste in the tongue, doctor prescribes zinc. Why? Because the inflammatory process it will bring down. If there is deficiency of zinc, then the tastelessness in the tongue will come. So, zinc is essential. Now, where you get zinc? Zinc you will be getting in the kidney beans. In Hindi it is called rajma. Kidney beans, then spinach, oyster, pumpkin seeds. Usually we eat the pumpkin, but seeds we do not eat. Mind it, it has lots of zinc. So, pumpkin seeds also to be eaten. So, now we are clear what are the things to be eaten and what are the things not to be eaten. This is all about acne. In addition to this, one important requirement is water intake. In a day, 3 liters of water intake is essential. 3 liters including water, your coffee, tender coconut, juice, whatever, but liquids should be 3 liters to be taken inside. So, that itself will keep you hydrated and energetic, which will be more beneficial than the energy drinks. So, this is all about acne. Now, we will move to the next topic. Now, little bit we will discuss about the treatment of acne, how to treat it. There are several methods of treatment, but here being a homeopath I will tell you homeopathically how to treat acne. Basically homeopathy says that acne is not an external problem, it is because of we have some internal cause, that is why externally it is getting manifested. And it is very much clear to you now, the causes whatever we discussed, those are all internal causes. So homeopathy says you take the medicine internally to address the internal cause, so that externally this disease, this ailment recedes and goes permanently. So in homeopathy we do not suggest any external application for the acne. If you apply anything externally, that will go, but again it will come back. So for the permanent solution, if you want, then internal medication has to be taken and internal cause has to be treated. Now you see in homeopathy how it is effective. The cases what I have shown you the pictures in the beginning, I will show you after treatment how those cases have improved. This is the first case I have shown you. In the menopausal time the lady was having this problem of acne. So it was before treatment, you can see how furious it was. After treatment, now we have in this picture we have seen how 80 to 90% it has gone. Further also it has completely gone. So remarkable difference we can see not only in the acne but also in the skin texture. The beautiful skin texture has come up. Another case we will see. Because of the medication how this lady has suffered, how it was full of painful acne pimples and how it has beautifully reduced after the treatment, before and after. Not only the pimples have reduced, inflammation has reduced, but also the skin texture has reduced, is not it? This is the boy in the puberty age was having pimples, acne. You see how it was a group of pimples gathered here and everything has vanished after the treatment. In none of these cases we have used any external ailment, we have any external medication, we have used only internal or oral medication called homeopathy, and that has resulted with such beautiful improvement. It is not only about the acne, any kind of skin problem, homeopathy says not to use any external application. See, this is a case of herpes. Herpes zoster, it is a dreaded disease, very much painful, and you see how it was full of blisters, and with homeopathy treatment it has gone, and after the treatment how the skin has become beautiful. The pain also has reduced and the blisters also have vanished. Next, we have a case of psoriasis. This is a case of psoriasis before and after. Psoriasis is a skin condition where excess skin cells will be produced by the body. So where it will go? Ultimately the skin will go on shedding the scales. So you get exfoliation of the skin, itching, inflammation, reddishness, all that. It is a lady of around 35 years age, and you see before treatment how it was the leg full of rashes, and after treatment how beautiful skin has come up. Here also we have not used any external application. Another case we will see. This is a case of psoriasis. The hands you can see full of rashes, how it was, and after treatment how the beautiful skin has come up. It is another case of psoriasis. Next, another slide. Again a case of psoriasis where the body, it is an old man of around 60 years age, the entire body was full of psoriatic rashes. So here we can see before and after how the abdomen, stomach part is looking. Similarly, back we had such type of rashes, and after treatment how the back skin has become healthy. Here too we have not used any external application. So this is how the homeopathy works for the skin. Now we will move on to the next topic, obesity. Obesity is also a problem which among these young people is more prominent. So what are the causes of obesity and how to take care so that we can avoid getting into this problem, all that we will discuss. But there is one peculiarity about this disease I want to reveal. Say, some people say that you keep drinking green tea, you will lose weight. Some say you don't eat, you do intermittent fasting so that you will lose weight. Does it work for all? Some say you drink warm water every day so that you will lose weight. Does it work for all? Had it been, then everybody in this world would have drunk warm water and everybody would be slim and trim. But does not happen, because one cap will not fit for all heads. Everyone is different. People say green tea you take, you will lose weight. How can it be possible? For some people, there will be a tendency called hypoglycemia. Hypoglycemia means the blood sugar will be always down. They need to eat on time, otherwise they will get headache, they will get tiredness, trembling, all that. So, blood sugar will be very much down. If you check the blood sugar, it will be around 70, 75 always. So, those hypoglycemic body, if they will consume the green tea, further the sugar will go down. So, you are planning to lose weight, but now you see further you are going somewhere worse condition. So, it is not true that everybody whoever will do one method will lose weight, because this obesity, this weight gain, it is also having its different patterns. All are not equally proportionately obese. The obesity does not happen the same way for all. How? We will see. Number 1, some cases we find the entire body becomes fat, head to toe the person will be bulky, like sumo wrestlers you find. Number 2, there will be a pattern where only the upper part of the body is fat, but not the lower part. We can see the picture. This is the picture where you get entire body is fat. The face itself is fat, arms are fat, chest is fat, abdomen is fat, waist is fat, entire body is fat. This is a picture where we see upper part of the body is having obesity, but you see the legs are very thin and normal. This is only the upper part, it is broad. While in the other case you see the lower part of the body from thigh to legs you have obesity. So, 3 patterns I showed you, one is the entire body, other is upper body, other is lower part of the body. This is another one peculiar pattern where you get the obesity only around waist, only around abdomen. You see the face, the legs, hands, everything is normal, but the weight gain is happening only around the abdomen, around the thigh. Small boys will be there, they will be putting on so much weight around the waist area, around puberty and all, that you find difficult to get a matched dress, matching size pant. You often have to go for stitching, because the body proportion has become imbalanced. So, these are the different types of obesity. Now, when such different patterns of obesity is there, how can you say that one common remedy can help all? As per the different patterns, the different methods of treatment will be there. If we can avail that, then we can get rid of it. In homeopathy, we have that scope. In homeopathy, we study about different medicines for different pattern of obesity. And another scope in homeopathy for obesity is that if it is because of hereditary origin, if my father was obese, my grandfather was obese, so that is why I am obese. Genetically it has come. If it is in the genes, then also homeopathy has a scope to address it. This is about the treatment part I am saying, homeopathically how we can address. And besides that, the food intake, water intake, those 2 factors also play important role. In the food, particularly the oil consumption, all kinds of refined oils are bad for health. So, it is important that as less as possible of oil consumption we should do. And as I suggested earlier, the fat, the white sugar, white maida, white bread, also all that white things should be avoided, refined carbohydrates to be avoided. Those are essential to avoid obesity also. The number 3 is the physical exercise. Exercise is a must for us, for all. Whatever busy schedule you have, it is mandatory that 30 minutes of walk you go for with shoes. When you go with shoes, then the shock absorption will be better, and when you walk, lot of stress release will happen. When you are doing your study, after all it is a stressful work, and when the stress gets accumulated, it has to be released. So, when you walk, that stress will get released and you will feel energetic to gather energy further to work. So, these are the 3 ways to adapt to avoid obesity. The causes, as I told you, genetics, it can be hormonal also, stress related also, lack of physical activity. 5th one is acanthosis nigricans. Acanthosis nigricans is a medical term, but if I show you the picture, very well you can recognize what is it. In the neck area, we find thickening of the skin. Skin becomes dark, thick, brown color. So, people think that I am wearing a necklace, I am wearing a chain, that is why it is all happening. No, no, that is not the reason. The reason is metabolic syndrome. It is called metabolic syndrome. That means the metabolism is defective. That is why in this area, the skin cells are produced more. That makes the skin of that neck thick. And this is the case, you can see acanthosis nigricans, how the skin has become thick. And for this homeopathically when we treat it, after the treatment it has become like this, healthy skin has come. For this also we do not use any external application. We have to take care of the metabolism. For addressing metabolism, whatever medicines we have, when we give that, automatically from the inside, this excess of skin cell production, it reduces. Hence, you get rid of the problem. So, this is another one cause of obesity. Many of the obese person, you will find this area is thick and skin is brown, dark. So, that is a sign of metabolic syndrome. In the puberty age, usually this acanthosis nigricans, it is more prominent. If it appears, then you can suspect that at any time in future, this boy or this girl may develop obesity. Right now in puberty age itself might have developed, if not also, this is an indication that metabolism is becoming defective. So, he or she may develop that obesity later on. So, that is a warning sign, you can say, and if it is treated on time, you can get rid of it. The next important topic is very important, called hormonal imbalance. It is like the engine because of which the entire vehicle moves. If the hormonal imbalance takes place, not only physical ailment, but also psychological ailments happen. And there is no part of the body which does not get affected by that hormonal imbalance. It is that much important. In case of women, this hormonal imbalance is more than the man. Why so? Because in case of a woman, the hormonal flux happens time and again, at the time of puberty, at the time of pregnancy, at the time of childbirth, menopause. These are the 4 milestones that a woman undergoes through, and these are the times when the hormonal imbalance takes place. So, for many women, this imbalance comes back to normal automatically, but for many it does not come back to normal, it leaves its impression permanently. So, what are the possible ailments we can expect because of hormonal imbalance? We will see into the cause, that will give us the clarification. There are 6 causes that can bring the hormonal imbalance. Number 1 is aging. As I told you, different milestones happen, accordingly different hormones start releasing, and some may become more, some may become less. So, that can be a cause. Number 2, stress. Stress, if you are under stress, then stress hormones will get released. As I've shown you in the previous slide, the hormones because of stress, cortisol can be released, then corticotrophic hormonal CRH also can be released. So, those hormones they will go and they will stimulate the various glands that will cause acne like problem, that may cause excess oily skin, that may cause mood swing, etc. So, stress may also happen because of hormonal imbalance. Then number 3, unhealthy diet. As I told you, if you eat wrong things, then like excess of sugar if you take, excess sugar if you will take means excess insulin will secrete. Insulin is what? It is only a hormone. So, more insulin will come. So, that is again will produce further imbalance in the body. Any hormone which is more in quantity or less in quantity than required is called hormonal imbalance. So, dietary error may bring also hormonal imbalance. Insufficient sleep, that is also possible. If sleep is not sufficient, then the gloomy, sad and heaviness in the head, all that will remain. So, the stress will automatically happen and stress releasing hormones, they will produce the abnormality in the body. Thyroid issue is very, very important as a hormonal imbalance. A woman, when the childbearing age is there or post delivery, it is a very common problem, because thyroid gland is very much important as an endocrine gland for the child bearing. Now, if thyroid gland is more or thyroid gland is less, both are called imbalance or abnormal. If it is more, it is called hypothyroidism. If it is less, it is called hyperthyroidism. So, you have two conditions, it can be hyperthyroidism, it can be hypothyroidism. Symptoms will be different. In case of hypothyroidism, where the TSH, thyroid stimulating hormone will be more, that is a hypothyroidism, there you become obese, fat. While in the hyperthyroidism, the thyroid hormone TSH will be less and you become emaciated, thin, lean and thin, emaciated, increased hunger, palpitation, tremor of the hands, all these will be there in the hyperthyroidism. So, thyroid abnormality is a major cause for the hormonal imbalance. As I told you already, pregnancy contributes in the majority of cases of imbalance of hormones, mostly the thyroid hormone. Even we can have the pituitary abnormality, pituitary hormone abnormality during the pregnancy or after the pregnancy possible. So, these are the main causes of hormonal imbalance. Now, we will watch a small video representing how hormonal imbalance causes a problem called PCOS. PCOS means polycystic ovarian syndrome. Ovary cyst, which is a very, very common ailment among these young girls. Why it happens? It happens because of the hormonal imbalance, and how it causes, how the hormonal imbalance causes ovarian cyst. Just we will watch a short video. Not only that, also we have another ailment called fibroid in the uterus. Uterus fibroid is nothing but because of the abnormality in the hormones. If there is an abnormal hormonal secretion in the body, that also results in the uterus fibroid, because of which there will be excess menstrual bleeding, there will be delay in the child conception, that will be infertility. Infertility even can happen because of the PCOS, polycystic ovarian syndrome also. So, for both the ailments, the cause is same, that is called hormonal imbalance. So, which hormone is causing which kind of disease and how it causes? Small 2 video clips we will watch so that it will be clear to us.
Polycystic ovary syndrome, or PCOS, is a common hormonal disorder affecting about 10% of all women of reproductive age. PCOS is diagnosed when at least 2 of the following symptoms are present: irregular periods due to missed ovulation, excess male hormone androgen as evidenced by lab test or physical signs such as excess facial and body hair, severe acne, and baldness. presence of numerous small fluid-filled cysts in the ovaries, which can be seen as dark circles on an ultrasound image. This is the symptom that originally gave the condition its name, but is not always present in PCOS patients. PCOS is highly heritable, but the inheritance pattern is complex, with multiple genetic factors implicated in the susceptibility to the disease. While the exact cause of PCOS is unknown, disturbances in a number of hormones are thought to be responsible. PCOS patients usually have excess luteinizing hormone, LH, together with a relatively low level of follicle-stimulating hormone, FSH, and increased levels of insulin. An ovary contains hundreds of thousands of immature eggs. Each of these is enclosed in a structure called a follicle. Each month, a number of these follicles develop, compete with each other, and one of them survives and gives rise to a mature egg that is released during ovulation. Follicle development is mediated by FSH, a pituitary hormone. In PCOS patients, FSH deficiency results in arrest of follicular maturation. The follicles stop halfway through their development and become cysts. Impaired follicular development means no mature egg produced or released, hence the absence of ovulation. Insulin is a hormone produced by the pancreas and is necessary for consumption of blood glucose by the body's cells. Increased insulin level in PCOS patients is a result of the body compensatory response to insulin resistance associated with PCOS. Excess insulin, together with high levels of luteinizing hormone, induce and maintain overproduction of androgen by the ovaries. Common complications of PCOS include infertility, miscarriage or premature birth, type 2 diabetes, obesity, cardiovascular diseases, mood disorders, and endometrial cancer.
Today's topic is uterine fibroids. Uterine fibroids are benign growths of the uterus that often appear during the reproductive years. Also called uterine leiomyoma, uterine fibroids depend on estrogen and progesterone to grow, and therefore are only relevant during the childbearing or reproductive years. Uterine fibroids decrease in size or calcify after menopause due to a decrease in hormone production. A woman can have one uterine fibroid or multiple fibroids. Fibroids are common and account for 3% of reasons why it may be hard for a woman to get pregnant. Occasionally, they cause recurrent miscarriages. It was estimated in 2013 that about 171 million women were affected by uterine fibroids. Large fibroids may push onto the bladder, causing a frequent need to urinate. Many women develop uterine fibroids sometime in their life, but may not be aware, as it usually causes no symptoms. Uterine fibroids are commonly described based on their location in the uterus. Intramural fibroids grow within the muscular walls of the uterus. They are the most common. Submucosal fibroids bulge into the uterine cavity beneath the inner lining of the uterus. This position is responsible for the minute cases of infertility associated with uterine fibroids. It is reasoned that this location may disrupt the function of the lining and the ability of the embryo to implant. Subserosal fibroids grow beneath the serosa and project to the outside of the uterus. Cervical fibroids are located in the wall of the cervix. Uterine fibroids almost never develop into cancer and are not associated with an increased risk of uterine cancer. Causes. The reason why women develop fibroids is unknown, but research points to the following factors. Genetic changes. Hormones. Estrogen and progesterone hormones appear to promote the growth of fibroids. These two hormones enhance the development of the uterine lining during each menstrual cycle in preparation for pregnancy. Abnormalities in the blood vessel system. Known risk factors that can have an impact on the development of fibroids are family history, race. Black women or women of African descent are 3 times more likely to develop fibroid. Obesity, polycystic ovary syndrome, diabetes, alcoholism, a vitamin D deficiency, and eating red meat. Symptoms. Many women with fibroid don't develop symptoms. However, if symptoms exist, they may include heavy menstrual bleeding, frequent urination, pelvic pain, including pain during sex, a backache or leg pains, difficulty emptying the bladder, constipation. Diagnosis. If you have symptoms of fibroids, your doctor may carry out the following test and imaging techniques. An ultrasound. This gives your doctor the picture of your uterus and enables your doctor to confirm the presence of fibroids. The doctor may then map and measure the fibroids. If you have heavy menstrual bleeding, your doctor may order a lab test to investigate potential causes. This may include a complete blood count to see if you have anemia, and other blood tests to rule out the possibility of bleeding disorder or thyroid problems. MRI can show the location and size of your fibroids. Hysterosonography. For this, the uterine cavity can be expanded by using sterile saline, making it easier to get a picture of submucosal fibroids. Hysterosalpinography may be recommended if fertility is of concern. Hysteroscopy to expand the uterine cavity, allowing your doctor to examine the walls of the uterus and the openings of the fallopian tubes.
Now, when we are ready to start our journey towards success in this young age, the first is to write the test, to write the exam. So, what is the challenge while going to write the exam? Challenge is that the huge number of chapters to be finished and then to be prepared in a short span of time. That is the challenge. So many chapters are there, such a huge, the course syllabus is so huge. How will I finish it in a short span of time? That is the challenge. I will share with you a beautiful tip to do it. There happened one athlete in the Japan, his name was Yamada. He was a runner. In the year of 1984, unexpectedly he won the World Championship of Tokyo Marathon. All the reporters, they flocked in. They asked, "What is the secret of your success?" Yamada replied, "I defeated the opponents with my wisdom." Reporters were surprised. Winning a running race and using the wisdom, they could not correlate, but they did not ask further anything. 2 years later, in the year of 1986, Yamada again won the world championship in the another marathon, that is called Italian International Marathon. In 96, again when he won the Italian International Marathon running race, again the reporters went and asked, "What is the secret of your success?" He said, "I defeated the opponents with my wisdom." Again they were surprised. 10 years later, his autobiography came. In that he has revealed the secret. He said, "Before I start running, I take the tour of the entire track that I have to cover during the race, and I mark the important eye-catching points in between. Say I have to run 40 kilometers, I will see after 10 kilometers there is a house, next after 10 kilometers there is a bank, next after 10 kilometers there is a post office. After that the final 10 kilometers is ending where I have the flag of finish." So at the beginning when I start running, my aim is not about the 40 kilometers. My aim is only the first target, that is the 10 kilometers away the house. So I run 100 kilometers speed and I try to reach there first. As soon as I reach the first target, then I strive for the second, then I strive for the third, and then the fourth. Earlier, I did not know about this formula, so I was losing in all races. And the reason I found out, That time I was thinking at the beginning, oh, I have to run 40 kilometers. So I would start at 10 kilometer speed. But since the day I have evolved with this technique, I haven't lost any of the races till date. This exactly the same technique, my dear students, we can apply when we are doing the study. You have 30 chapters left for you to study. Yes, and time duration is only 10 days. What will you do? You not to worry about the 30 chapters. You only have to plan, you have to divide these 30 chapters into segments. You divide that, yes, every day 4 chapters I will study. And first day, my aim is not 30 chapters, my aim is only the 4 chapters. So, 4 chapters when you do, in 7 days 28 chapters you have finished, on 8th day another 2 chapters, then after you still have 1.5 days time with you to do the revision. But if you keep on thinking 30 chapters, 30 chapters, 30 chapters, then nowhere you will be reaching to. And the firmness, the confidence with which you have to go to the examination hall, that you will be lacking of. So, always you divided the big target into small bits of targets and go on achieving one after other and finally reach the goal. This is a technique that we can very well successfully use when we have the examination on our head. So, in order to get rid of this examination fear, this will help us in a great extent. Next, about the stress management. It is a lesson that throughout our life we have to keep learning. Here I will give you one tip. Stress is not a factor which we can avoid in our life. We cannot say this world, it can be free from stressful situation at any point of time. The stress always have to be there in this world, because the God has created this stressful situation type of pattern in this world itself. The God has created the world in such a pattern that always the stressful situations will be there. Why so? It is because God wants us that when we pass through such stressful situations, then our physical, emotional, spiritual abilities should flourish, should develop, and we come out as a better personality, so that we can face further boldly to the future challenges of life. You can ask, how can it be possible facing a stressful situation and becoming a better personality? How it is possible? See, if there is a student says, throughout the year I don't want to trouble you, teacher, I will be studying, there is no doubt, I will cooperate. But at the end of the year you don't tell me to write the tests, I will not be doing that. Now teacher will be worried. He will say, my dear student, if you do not write the test, you do not pass out, then how can it be you be promoted to the next higher class? In order to get promoted to the higher class, it is mandatory that you undergo the tests. So, same way, when we undergo a stressful situation, then the outcome is that we have a better personality within us. That is why stress always have to be there in this life, and we should equip ourselves to pass through these stressful situations. People come and say, why there are disasters, why there are floods, why there are famines in this world. Recently in Orissa there was a train disaster happened. People said, why did Lord Jagannath allow it to happen? He should have prevented it. No, deliberately the God has created the world in this way that the stressful situations always to be there, and we should be well equipped to pass through this. We have all studied about Darwinism, isn't it? What does it say? That if you are the fittest, then definitely you will survive. Survival of the fittest is Darwinism. So, when we are the fittest, we will say I am the fittest so that I will survive. Darwin also has said about it that those people who respond to the situation positively, they will survive, they are the fittest. How to respond to the situation, there lies the trick, and that is called the art of living the life. I will give you a small example that how to respond to the situation which is having negativity in it. How to respond to a negative situation in a positive way. An example, a woman was there, a mother. She was extremely tired, fatigued, extremely worried. She used to think, I have to do the cooking in my home for the entire family. I have to do the household work, maintain the neatness, cleanliness of the house. I have to again go to my job. I have to work. So much of workload on my shoulder. How do I do all these things? How do I maintain my balance? With so much of worry, she saw her daughter, small school going daughter. She was sitting on a sofa and going on scribbling on a notebook with a smiley face. The woman was surprised. She went near the daughter and asked, "Baby, what are you doing?" Baby said, "Mommy, there is a task given by the school teacher, so I am doing that." "And what is it?" The daughter replied, "I am writing on negative thanksgiving." Mother was surprised, such a small kid and uttering such strong words, that is negative thanksgiving. She was very much enthusiastic. What is that she is writing? She said, "Can I see?" Daughter said, "Yes, mommy, you can," and handed over the notebook. The mother took the notebook and started reading out what she has written. The daughter has written, "I am thankful for the final examinations are coming. It means the summer vacation is not far away. I am thankful for the bitter medicine pills. It means I am soon going to recover from the disease. I am thankful for all the scoldings that my parents give. It means I have caring and loving parents for me." The mother was astonished. She gave back the notebook, went to her room and sat on the chair and started thinking, why not to apply the same strategy for my life too? Now she started thinking, I have to cook because I have a family. I am blessed with a family. I have to do the household works because God has given me a beautiful shelter to live in. I have to go for the job because that gives me financial independence. Now you see, the situation did not change, situation remained same, but the thought process had changed. The same work from which she was getting stressed out, now she is getting inspiration from that, and that work no more giving burden to her. So this is a way that how in a negative situation we can think positively. That is just like seeing the lightning in the dark clouds, which we say as the silver lining in the dark clouds. So this is how we are supposed to move in our journey towards the success. So physical preparedness, emotional preparedness, both have to remain there. So with this, I wish you all very good future, bright future, May this college be proud of you one day because of your name. Thank you.